But we begin tonight with a very stark reminder that the coronavirus pandemic is not over. The White House is announcing today that the president, for the very first time, has tested positive for COVID-19. In a statement, the White House noted that the president is fully vaccinated, he's twice boosted, and experiencing very mild symptoms. The president's physician, Kevin O'Connor, clarified those symptoms do include a runny nose, fatigue, and an occasional dry cough. He's begun treating the president with the antiviral drug Paxlovid. And following the announcement, the president took to Twitter writing, "Folks, I'm doing great. Thanks for your concern," while also expressing regret for canceling a scheduled visit to Pennsylvania. First Lady Jill Biden, a close contact to the president, has tested negative. She briefly spoke to reporters about the president's diagnosis and her own scheduled visits today in Detroit.
My husband tested positive for COVID. I talked to him just a few minutes ago. He's doing fine. He's feeling good. I tested negative this morning. I am going to keep my schedule. I am, according to CDC guidelines, I am keeping masks.
President Biden, as a fully vaccinated, twice boosted adult, has more protection against COVID than most Americans. And he caught the virus anyway. And that just highlights the pervasiveness of these newer strains of COVID that are circulating. And it's a reminder they can infect even the most well-informed people who are cognizant of the risks associated with the virus. And the data backs up all of this. BA.5, the latest Omicron subvariant, is believed to be the most transmissible variant yet. According to the CDC, it's now responsible for roughly 80% of new infections. If you've been keeping track at home, that number just keeps going up and up and up. COVID cases in the country are now rising in more than 40 states. And since there's currently a pretty significant undercount of cases, it's likely things could be even worse than we know. Hospitalizations have also seen a 17% increase since the start of the month. According to the New York Times, more than 37,000 people are in American hospitals with COVID on average every single day. So COVID is a huge problem. It is not an afterthought. This ain't over. And the question is, will we actually try to limit its spread instead of embracing the fact that more than 100,000 people are still getting infected every single day? Joining me now, Dr. Uche Blackstock, someone I talk about COVID with very often because you and we're not under any delusion that the pandemic is over. I'm not in a part of the mass delusion that's happening. But let's start with the breaking news about the president, Dr. Blackstock. President Biden, let's be honest here, he's 79 years old, but he's fully vaccinated. He's got all of his booster shots, the 2 booster shots. What type of toll do you anticipate this infection taking on the president?
Zerlina, thank you so much for having me on. So it is not insignificant that an almost 80-year-old, even though he is vaccinated and double boosted, has been infected with COVID. When we look at who is most likely to be hospitalized and die from COVID, even among the vaccinated, it is the people who are elderly or people who are immunocompromised. So he's still at very, very high risk. It was critical that his physician started him on Paxlovid, which is an antiviral pill that prevents the replication of the virus. But I would say he needs to be monitored very closely. The range of symptoms can last for about 9-10 days or even more. It really varies depending on the individual. And so I would say that his healthcare team will have to keep very close watch on him. And while they do, be as transparent as possible with the public.
One of the other questions I had is, it wasn't surprising to me to hear this news because the president just traveled internationally and he was at the G20 gathering with other world leaders. And there was a lot of talk and controversy about the COVID protocols associated with that type of trip. Were you surprised to hear this news given that context?
So I wasn't surprised at all. And it wasn't just the trip, but, what we've noticed is, we know that COVID protections have been lifted. We know that even within the White House, the president doesn't always wear a mask, right? And so even though people are tested regularly and some other precautions are put in place, people have become very relaxed. And this is what happens when we've relaxed precautions and we have a more contagious variant. So even someone who is as protected as the president is still vulnerable. So it wasn't a matter of if this would happen, but when this would happen, given what's happening now, given the more contagious variant, given that he is traveling and there are questionable precautions being taken in those areas. And so, I really hope that he does well. He has good chances of doing well, being vaccinated, double boosted, and Paxlovid. But I think the next few days are going to be quite critical for him.
Help us understand the risk of the BA.5 variant. You already mentioned that it's more contagious. I don't know if the data is certain, or there's enough data to say it's more severe. But what are you reading about this variant that folks should know about at home?
Okay, so three things make a variant of concern. One is that they're more contagious, right? BA.5 is definitely more contagious. The other is that it evades immunity. And so BA.5 does evade immunity, vaccine-acquired immunity, previous infection-acquired immunity. And so that's why we're seeing it really infect as many people as we've seen to such a large degree. We do not have any data, though, that it increases the severity of the disease. But because it is so contagious and because it evades immunity so well, we are seeing that uptick in hospitalizations because more people are being infected as a result.
It's really important to keep in mind that vaccines do not prevent infection. They prevent severe infection, potentially. So the masks are important to keep in mind. A year ago, the president said, quote, we are now declaring independence from this deadly virus. A lot of us, I think, were thinking we were past this. There was a lot of talk about an endemic state of the COVID pandemic, and I was like, yeah, I don't think we're there yet. And my dad was not in agreement with that assessment.
Right.
What do you think? And how do we snap America out of this mass delusion that the pandemic is over?
Zerlina, I think we really need to have clear public health messaging saying this, COVID is not going anywhere. There will be surges and there will be times when the transmission levels will be quite low. Here's what we need to do during surges. You may need to have to put your mask back on when you're indoors. You may have to test more frequently. We still need a push for people to get even their first time vaccinations and then boosted. We have a significant number of people who are fully vaccinated but not boosted. And so this is not over, and we are clearly not protected from this virus. And learning to live with COVID doesn't mean just lifting all precautions. What it means is how do we reduce the degree of harm to everybody, right? So how do we decrease infections? How do we decrease long COVID, hospitalization? And what that requires is not just vaccinations, but also masking and testing and all the things that we've been talking about for the last 2.5 years.
Really, really important. You guys stay vigilant out there. Listen to the doctors and the scientists. They know what they're talking about. Don't listen to the political commentators. We don't know what we're talking about when it comes to the science of the thing. Dr. Uche Blackstock, thank you so much for being here. That's why we asked you guys, so that we know what to do. Please stay safe. Hi, I'm Zerlina Maxwell. Thanks for checking out our channel on YouTube. You can see more from Zerlina by clicking any of the videos on this screen, and make sure you subscribe below to stay up to date on the day's biggest stories. Thanks for watching.